Hello and welcome to this episode of TheSquare. I'm here today with Gerard and Nikki, who head up our healthcare practice here in the Los Angeles office. Welcome.
Thank you for having us.
Thank you.
So glad to be here today, guys, to be talking about healthcare burnout and design and what people are looking for. Kind of one of the things that got me thinking about this was just how much the office has changed in the past couple of years on the heels of this pandemic, right? I know everyone's tired of hearing that, but it really kind of created this sort of line in the sand between how we used to work and how we work now. And there's so many moments like this in several industries. If you think about maybe aviation, 9/11, for instance, was sort of another line in the sand for aviation about what security and moving through an airport looked like before and then after, right? And I feel like the pandemic, we think about, obviously we think about the office and remote work and coming back to the office. But for healthcare, it was also a sort of very momentous marking of what worked and what didn't work and changing things for healthcare operations, for patient experience, and even for staff. Do you guys want to talk to me a little bit about sort of the bigger changes that you're seeing and some of the vulnerabilities that you think were most exposed on the heels of the pandemic?
Well, I think one of the first things that was exposed was honestly the level of burnout with our healthcare providers. Before the pandemic started, there was already the burnout, like at the forefront. Honestly, they were exhausted. Now it's just been magnified by this. People working crazy shifts, they're short-staffed, picking up double shifts, even triple shifts sometimes, bringing in travelers to pick up time too. It's just everybody's exhausted, and they just, they're trying to figure out how to cope with that.
Yeah, it was like an already strained profession, strained even more. I recently saw a sign outside of a fast food restaurant by my house that said, now hiring people that show up for work. Right? But it's one thing if your Taco Bell doesn't have enough people to work there. It's a completely different thing when your hospital or an emergency room or behavioral health facility doesn't have enough people to work there. What kind of challenges does that create?
Yeah, I recently interviewed a doctor, Dr. Rosenberg, over at UCLA Resnick. She talked about how the pandemic affected the staff. Obviously with the strain of the pandemic, the string of patients that are coming in due to behavioral health issues just increased. And the effect it has on the staff also affects how they experience or provide care. They talked about how they want a space that helps staff alleviate some of the stress. They want to work in a better working environment, and I think us as designers and healthcare professionals have a way to help them achieve that goal.
Yeah, you bring up a great point. It was like there was this already strained and dwindling talent pipeline, and then oh, by the way, we're just going to up the ante when it comes to the ask that we have for this workforce. Nikki, you want to tell me a little bit about your background? I know that you have a very interesting background that gives you a little bit more insight onto what this group is actually facing on a day-to-day basis.
Yeah, so before I got into design, I worked for 7 years as a registered nurse. 5 years of that I was in trauma ICU back in Pittsburgh, Pennsylvania. And then I did travel nursing for 2 years. Pretty much all ICU, but as a traveler, you kind of get floated everywhere as needed, so you get a little bit of everything. And I was there with that burnout. I was there mentally. I was trying to, I was sending my applications out for architecture firms and all that, but I had to continue working for probably about 3 years before I finally got into design. So it was exhausting. I was burned out after year one, honestly, as a nurse. It's hard.
Well, I read once that, we often think about nurses and doctors as being this like pinnacle of health. But in reality, because of the nature of their jobs, they're sometimes the least healthy among us. Maybe they're not eating right, kind of scarfing down the Doritos from the vending machine.
Right.
You can't really carry around your water as you're moving through the floor. Can you walk me through some of the physical, mental, and emotional well-being challenges that you might face as a healthcare provider?
Sure. You're working 12 plus hour shifts, sometimes 16. It depends where you're at. But you don't always have time for breaks. Like working in a level 1 trauma ICU, there were times where I would go inhale my food while I was standing at the nurse monitors watching my patient because they were that sick. It's mentally draining. There's times when you couldn't even go to the bathroom because you didn't have someone to cover your patient or you didn't feel comfortable leaving them. It's just, you're seeing death constantly. You're seeing families sad. You can't fully engage with them sometimes. You have to learn to separate yourself from the situation. And when it's happening constantly, as in with the pandemic, seeing that much death, mentally it takes a toll on you. You take that stuff home with you no matter how hard you try not to.
Yeah, it's not just physical. There's a sort of emotional always being on factor as well. And you see a lot of stats about nurses and doctors, primarily nurses really, being sleep deprived, overweight, struggling with the sort of fundamentals of physical wellness.
I think that's one of the things that we tried to resolve as healthcare architects and designers. How do we bring a better working environment to them, knowing the challenges of their profession? I think one part of it is the ability for them, like Nikki mentioned, to have a space where they can disengage from their day-to-day activities. And I think having an access to a landscape area or a conference room that has a light shower that can affect their mood or be able to be in a silent room helps a lot in giving them that wellness that they need or a break.
Yeah, you think of amenities for patients, right? Because the hospital or whatever healthcare facility is primarily thought of as a place to serve patients, but you can't really think about patient care without considering those that are responsible for delivering that care.
The staff get overlooked a lot. They really do. Obviously, patients are number one in our designs and what we want to do. But coming from the nurse side, I've seen the stress that they go through firsthand. I've seen people get kicked, punched, choked. I've had a patient table thrown at me by a schizophrenic patient once. I've seen that stuff. So my goal is always to bring the people that need these things, need the respite, need the stress relief, bring them to the table, ask them what they need, ask them what doesn't work about their space. Their voices get overlooked a lot too. Yeah. So I want them to speak up and I want them to get their voices heard.
And I think if we can design a space that's efficient, that's calm, I think it benefits both the patient and the healthcare provider because they're moving in an environment that resonates that type of environment that they wanted to be in. So often these patients are stressed out. They're worried about what their health condition will be, whether they know it or not. And if we can give that sense of assurance that healthcare space is there for them, and that space is a place where they can heal at their own pace, I think it speaks a lot to how that space will benefit them and also the staff.
Gerard, you bring up such a good point because, we talked about the sort of corporate pivot we've seen over the past couple of years. It's been this like slow and steady return to the office here, but we've seen workplaces being very intentional about thinking about how the design directly benefits and supports their staff because they know that it ultimately drives their bottom line and supports their talent, keeps talent there, attracts new talent. And I think that maybe in healthcare spaces, similar to schools, we don't necessarily think of those spaces as workplaces, but they really are. I want to get into some of the design benefits like the outdoor features and the amenities, but I think it's important to think about what the benefit of supporting healthcare staff actually means for patients and even for healthcare operations and their bottom line.
I'll say that I've seen a couple of studies recently that say that like over 50% of healthcare providers are considering leaving. the profession. So I'd say first and foremost, you have to keep them in the jobs because there won't be enough people to take care of these patients, especially with the aging population. They're projecting the patient population is going to be growing exponentially as
It's
well.
like the next surge, right? The next tsunami of
Exactly.
what's going to strain us.
What I'm seeing somewhere where the industry is moving to is the ability to use technology in concert with the staff. You see a lot more robotics happening in ORs, and the ability to project images as you're actually doing, a cath lab facility or a hybrid OR where you've got the expertise of the surgeon combined with the technology. I think that's where it's going to move towards to. And I think the patient care spaces should move towards that. If you think about, like, for example, a regular patient room, if a patient can order food through a menu, why can't the staff do the same?
Yeah.
Where they don't necessarily have to leave the unit, but they can order food from the cafeteria and get it brought up to them, and brought up to a space where, if it's designed to where it's integrated with the landscape area, they can take a 30-minute break and be on a wellness nature walk where they're enjoying their coffee or their food, they're able to disengage from that daily stressful environment and then actually focus on the bigger issue, which is, how am I helping the patient
Right.
go to be better.
Yeah, when we're thinking about the benefits of thinking about healthcare spaces as not just a place for patients, but even as a workplace for healthcare
Right.
providers, you start to address this issue of the talent pipeline, a very scary issue to think about when so many people are considering leaving. But then you also start to bring up opportunities for efficiency because, there's issues of patient outcomes and providing them the best level of care and making sure that there aren't errors and minimizing errors. If I make a spelling error at the office, it's lower stakes than if there's someone's life on
Major
the line.
medication errors happen with
Waste, the cost of all the operations go up when people are tired and burnt out and kind of mailing it in maybe.
Right.
So all of these efficiencies ultimately affect their bottom line, but even at the end of the day, patient outcomes too, I would imagine.
Another thing that's growing is telehealth, and it's being integrated a lot more. Telehealth visits have been growing majorly, so creating spaces for providers to be able to give adequate care over a computer, that's a big change that's happening because I know a lot of people used to avoid that. They don't trust, technology, especially in rural America and other places.
Yeah.
I was just at a nursing conference in South Carolina at Clemson University, and it was about the excellence in healthcare design. And they were also talking about home care a lot, too. There's a big push in moving towards home care again, which is kind of crazy. It's like a full circle moving forward with the telehealth, but also going back to home visits. So we got to start thinking about stuff like that as well when we are thinking about our designs.
So when we're talking about patient outcomes on the line, the cost of healthcare operations, I mean, that's a major headline in and of itself. Attracting people to the profession. Clearly, there's a case for design that supports our nurses, our doctors, and our healthcare providers. I'd like to talk a little bit about how we actually do that. It seems like there's opportunity for their physical wellness, their social wellness, and emotional and mental health even. So let's start with their physical wellness. Nikki, you brought up some of the challenges of even just being able to access food and water throughout the day, or being able to use a restroom, or being able to get sleep when you need it. How can design help support some of these really basic functions, and maybe even get beyond some of the basic functions and give them some of the perks like we get in the office, like circadian tuned lighting and biophilic elements, or we get connection to the outdoors?
Thinking about safety is a big one. A lot of the older facilities, they didn't have the studies, the research that we have now. There's units that I've worked in before that I've been kind of trapped. We used to say trapped on an island where people can't even hear us when our patient needs us. We could be in there for a code, and it's hard to get to other people to get help into that space. So talking to the nurses, the providers firsthand, and finding out what doesn't work about their unit. How far are they walking to get their meds? How far are they walking to get their supplies that they need to do the patient care? That they walk about 4 or 5 miles a day.
Yeah, I've learned that getting steps in for nurses isn't the problem, right?
It's the getting to sit down after the 5-mile walk,
Right.
and
Yeah.
in between all the
Yeah.
all the patient care. It's really it's taxing
So
physically.
how can you design? What are some solutions that you've seen in practice that, whether it's supply carts and kind of minimizing the number of built-ins so that people aren't constantly making laps? What are some solutions you've seen to help those efficiencies?
I think what we need to realize is the workforce is changing as well. From a design solution, we're seeing more decentralized nurse stations, where the nurses are closer to the patient rooms as opposed to going into a central nurse station. I think envisioning the nurse station as more of a collaborative space, as opposed to a regular nurse station that used to exist, 20, 30 years ago. I think looking at it as a collaborative space, and then using the decentralized nurse station as where they actually do their work. I think how you imagine that would be different.
It's interesting, just as you're saying that, it reminds me of some of the trends you're seeing even in workplaces, right? There's these collaborative hubs, and
Right.
then you have opportunities to peel off for some focused work where it works for you, and while still maintaining some sort of connection to the rest of your team and to your patients.
Another thing that we're seeing is, like, for example, the Veterans Administration, they're starting to change how they deliver care. Like for a regular patient, they would pair a social worker with a behavioral health professional, with a nurse, and a medical doctor. I think a lot of healthcare systems will potentially shift to where it's a patient, they call it patient-aligned care team, where a patient has a medical team around them. And I think as this pilot system by the Veterans Administration becomes successful, a lot of healthcare systems will be using the same type of approach. And similar to like a collaborative space, they need a space where each healthcare professional can discuss from an overall standpoint how their diagnosis affects a patient. I'm just thinking that this could be a collaborative space where they can pull up charts, they can pull up medical records easily, and be able to provide a course for that patient for treatment.
There's also a move towards like duplicating spaces too, with like supply rooms. And I spoke to a couple of nurses at the conference I was at, and they were saying that the challenge with that is you always have to make them as close, like replicate them as close as you can, because that's another thing with nursing. They don't have time to think when there's an emergent situation. They don't have time to walk into a room and be like, okay, where's this stored? Where's that stored?
Yeah.
So having 2 storage rooms strategically located, but having the stuff in the exact same space as the other room is a big help for that.
Yeah. So some levels of predictability, even probably not just in the supply room, but even in
Everywhere,
the patient.
the patient head wall, just everywhere, honestly.
So we've talked about collaboration spaces some, and when we talk about the workplace and collaboration, I feel like you can't have that conversation without talking about a break room. It's probably one of the bigger pain points for nurses. These aren't necessarily places that people can typically gather, or maybe are not even front of mind. And Nikki, like you mentioned, maybe they're so far away, it's like, I don't have time to go to that. How are you seeing that reworked so that way we can think about their nutrition and hydration and even some socialization?
I think if we can integrate that space to where it just does not relate to the patient, but relate to the staff as well. Like if you think about it, for us working professionals, there's medical office buildings or regular office buildings where, as you come in the main lobby, there's access to a coffee stand or breakfast. Why can't we do that for medical professionals? And where they can access these amenities similar to staff, maybe we have to design it differently so they can get theirs faster, more efficiently, while the staff is getting more in a relaxed environment, theirs is more in an efficient environment. Can we do something similar to that? And then as they go up to their locker rooms, is there a way we can improve it to where the sleep room is available next to it, or they have rooms, privacy rooms, where they can just disengage, or can we design an environment where they're in the middle of a landscape area where they can decide whether they take a break in a conference room or a break room, or they can take a break by walking through nature and just enjoying the outdoors. Or if it's a beautiful day, can they enjoy the outdoors without having to go too far from their unit?
Right. Because it's not just about having that amenity, if you will. It's about the location of it and how it's positioned, and probably even the policies and operations and how it allows staff to even be able to use it.
Yeah, a lot of places don't even mandate breaks for nurses. When I moved to California and they were like, okay, Nikki, it's time for your break. Tell me about your patients. I was like, wait, I get to go sit down? Like, what do you mean? Like, you actually have to leave. It's great. And that's how it should be everywhere. But just being able to go somewhere for 10 minutes even and close your eyes and disconnect, or like Gerard said, somewhere where you can look at nature, and even if that's just looking out a window and seeing nature through the window, like, it makes a big difference in your day.
Well, it's one of those things that if it's out of sight, it's kind of out of mind too, right? Because if someone's not prompting you to go unplug for a minute, I know, thankfully, I sit right by a window at the office, and so I see people kind of making their laps. I'm like, oh, someone went and got a coffee. I'm like, I ought to get a coffee.
Right.
And so, like, it reminds you to go do it. And I think that the location of these amenities matters for that reason as well.
And I think staff retention is going to be a major concern as the workforce gets or dwindles down, or the demand goes up, and we don't have enough workforce to fill those gaps. I think the amenities is going to make a big difference on whether a physician, if all else is equal, what's the difference? And I think amenities for staff and how their well-being is being taken care of in their own built environment will make a major difference for them, whether deciding to go to a specific facility or not.
Yeah, and locating them as close as possible to the units is absolutely necessary. And there's ways that you can use probably some technology, communications too, that might help that. There's a lot of new communication devices you can have so that at least you're reachable by phone or by page or something like that. But just being able to feel that you're close to the unit is a huge difference in getting people to actually use those spaces. So,
yeah, a lot of other industries are looking at the trends of future workforces and what does the future workforce or even current workforce look from their potential employer, and all these stats about what Gen Z wants, what millennials want, right? And amenities, we want a ping pong table, we want all these different things. And obviously healthcare has some limitations and restrictions just by the nature of the type of facility it is, and code and contamination and all of that. But you are still trying to attract talent that has these preferences, that comes from this sort of cultural background of, hey, you know what, I care about my own wellness as well, or I care about efficiency, or I care about mentorship, right? And I want to be able to continue to grow and learn in my position. And so just like we might look for that in our office spaces, and I think healthcare providers are also looking for that too.
I think for me, when I look at what the future of healthcare design will be, I think we have to look at the workforce that is coming up. like you mentioned, Gen Z is coming up. Um, they're technology savvy. They they can they can work multiple technologies or softwares all at the same time. If we think about that and translate that to healthcare, what does that mean? For me, that means can you have an ability where people can work at one facility, say in Los Angeles, but their residency is somewhere in the middle of the country or East Coast. Um, can there be a program where a certain facility ties up with a facility somewhere in the East, and they're able to get that different level of expertise at another facility because telehealth is going to be prevalent in the future.
Yeah, rural America really needs stuff like that with the telehealth because there's a lot of
Right.
places that don't have doctors. They don't have the primary care physicians they need. So the access to telehealth is huge for places like that, and training them, finding the people that can teach these patients like how to use the equipment and get that equipment to them even is a struggle.
What I've seen is that drones and technology is going to play a major role in the future. I think if you're trying to get healthcare to rural America, I think that will play a role. I went to an ACHE conference recently, and I talked to young students, and what they said is that what they see in the future is that someone can use their phone, use an app, and have that ability to reach that healthcare professional by either having a drone come over to them, diagnosing them, or essentially dispensing their medication through that technology, and then be able to diagnose them, and their doctors are able to check them and see if they're doing well. And then at the same time, that doctor could be more efficient because this drone could be teeing up multiple patients from different locations.
Yeah. I mean, there's such an appetite for technology when it comes to the future workforce and what they're looking for, right? I mean, they're of that generation and so fluid
Right.
with it. We've talked a little bit about the technology that connects the provider to the patient, but what about technologies like we have I feel like even more connected to everyone that I work with between Teams and between phone calls and emails and, other kinds of chats and all sorts of things. How do providers stay connected, and what's the future look like for that?
I think you gotta almost like look to the movies for that technology, and I think it's happening. Like the ability for one physician to connect to a specialist in the East Coast, or vice versa, a specialist in the East Coast connecting to another specialist here in Los Angeles, where they can do a telehealth, a collaborative telehealth, where they can look at an X-ray or a CT scan, and then have them be able to collaborate, pull up patient records.
They're even doing surgeries from across the country with the
Right.
robotics. Like,
Correct.
it's just mind blowing that we're able to do that stuff.
Yeah.
Imagine where we're going to be
Yeah.
in the future with that.
And then when we're talking about burnout and this sort of technology, how do you see technology easing? Because to me, I feel like being able to quickly write someone a note in Teams, or shoot someone a message in whatever fashion, really kind of speeds my work and hopefully makes me more efficient, less likely to burn out. Do you see the same possibility, or what sort of applications do you see to kind of help have technology ease burnout for providers?
I mean, sure. I mean, having access to any doctor in the country, I think would be great. You would be able to, if you didn't know the answer, or if you didn't have someone near you that had worked on that type of patient before, just being able to reach out and send them a message, and being able to connect to them with a computer, and being able to put them in front of the patient from across the country or even across the world, it could help ease
Yeah.
the burnout.
I hear a lot of physicians who are like, I had to call this doctor, and then I had to wait for them to call me back, and then I called them again, and then their receptionist put me on hold for 5 minutes, and that was like the only 5 minutes I had between two different patients. And so I think some of these like older ways of communicating are really not congruent with how quickly we need to move now.
I think there's gonna be we're gonna have to strike a balance, because as we're in transition, where the older generation has been used to working a certain way, and the younger generation coming in knowing, no, you can do this quicker. I think our solutions have to be tailored to that transition, and then eventually that solution will translate into where it's not necessary anymore. You're able to, like Nikki mentioned, you can leave a message to a physician through Teams, and they can pick up from there. I could see some frustration of that happening in say older generation.
Oh yeah,
professionals.
we're all resistant to change. That's for
Yeah.
sure.
Right.
And but that's an
Yeah.
interesting point, right? There's such a generational mix right now in the
Right.
workforce, probably more than we've had before.
Mm-hmm.
So there's certainly opportunities to think about phasing in technology. But then there are opportunities also that are that transcend generation, and this idea of, for instance, mental health and emotional well-being. It doesn't matter where you fall in your birth year, the idea of always being on exists for everyone. So maybe how do you address that? How do you, in design, think about the mental and emotional well-being of healthcare providers?
I think for me, designing a space that's balanced, like I mentioned, a place for them to be able to disengage, have the technology at their fingertips when they get into the patient room, and then have that ability to isolate themselves if they have to. I think plays a major role in us making a difference to the workforce, to the healthcare workforce, and giving that balance to them.
In addition to the spaces, are you seeing anything in terms of how you're approaching the design of these spaces, whether it's materials that are inspired by nature, artwork, anything like that?
Nature is a big part of it. It's also personalization too. I think unit by unit, it's different. So that's another reason why we bring the people that work on that unit to the table when we're figuring out what they need. What are they into? Where are they located in the country? Try to bring in things that make them feel comfortable, make them feel like they're at home. Because, I mean, they're there, like I said, for 12 plus hours for their shifts, and they need to be as comfortable as possible.
Yeah. So often you see break rooms or little respite areas that don't maybe receive the same level of design attention and detail.
Oh my God, yeah.
Yeah.
Just
I
lined
agree.
with metal lockers and no windows.
Yeah. And so
Yeah.
artwork and all of those things and materials probably make a big difference.
Also, like, if you look at it from an industry standpoint, if you look at, like, for example, airports, how come some of these airports have lounges for captains? Why can't we do the same for doctors, for specialists, or for any staff? Can we design a space where it's a lounge? There's this lounge feel for the staff, so that when they go into that room, they feel protected, they feel appreciated, they feel that they have all the amenities at their fingertips to, be efficient and be inspired as they're working through a stressful day. Or even like a car dealership, for example. You go into these lounge and they're well designed. All the amenities are at their fingertips. There's food, there's coffee.
Yeah.
Can we do that something for the staff as well?
I like that you said about all the other staff too, because there's so many staff members in a hospital that get overlooked, like the EVS, environmental management people, the ones cleaning the patient rooms every time. They're still seeing the same type of stuff that the nurses and doctors see. They're still doing the same amount of shifts as them too. They're all taking a toll right now.
Yeah, I love that you brought up airports, right? Because there's several building types where when you think of that building type, you think of primarily the consumer that uses it, right? Airports, you think of the passenger experience. Schools, you think of the student experience. in healthcare spaces, you think of the patient experience, but there's an entire like team of people off stage that really are probably most instrumental to what that experience looks like. And, you know, recently at Corgan, we did a study about what teachers want from their workplace, schools, like, because that is their workplace. And so a lot of these amenity conversations came up, but then also the idea of connection and mentorship came up. You know, I love that you brought up the lounge as it for healthcare providers, but, you know, meeting spaces, mentorship opportunities, professional development, socialization. How does that happen?
I recently pursued a project for a research lab, and research labs are changing in a way where it used to be very isolated. And I think research labs are starting to change where there are different type of spaces where there's a space for the researcher to work on their own. There's also a space where you combine them with other researchers, and the goal of that is for them to interact and find solutions, common solutions that could be used from one type of research to another. I think if we can create something similar where there's a private space or a silent space, and there's an active space for staff as they go about their lounge or their breaks, it gives them a natural setting to socialize, interact, and talk about work if they choose to. And that could be done in both a formal setting or an informal setting. That could be done, say, if you're integrating a nature walk into a lounge, you know, they could be walking through a path and they can talk about this patient was experiencing this, and they're actually discussing the diagnosis or the symptoms, but they're doing it in a different type of environment.
Yeah, it's these intentional and casual moments of exchange where, yes, maybe they're talking about a patient, but I can imagine that they're also talking about the sort of next credentialing they might want, or how their professional career might grow, or maybe even just making a friend there. That value of friendship is so important to retaining talent.
Yeah,
as well.
I mean, working in healthcare, we always called it our work family, because you're spending holidays with them, you're spending weekends with them, nights, you're always with them. So developing those relationships is key. I mean, we're humans, we're social people, so being closed off like we have been for, what has it been, 2.5 years now?
No one knows anymore.
I don't know.
Yeah,
Time's not real.
Yeah.
It's really taken a toll on everybody, but in healthcare design, if you have the collaborative spaces where you're not only are you talking about the patient, like Gerard said, but you're talking to each other about your family at home, you're talking to each other about your mental health, and are you doing okay today? You're getting your mentorship, you're learning from each other. That's another key thing that is a problem with this 50% of healthcare providers wanting to leave. Who's going to teach the younger people that are coming in? It's not an easy profession. You can go to school for it, you can get the degree, but until you're there walking in those shoes and taking care of patients every day, like, you're not able to physically and mentally learn everything that you need to do. It's a hands-on thing, and learning the critical thinking too. Like, that's something that we need to be able to collaborate at a table and discuss and draw diagrams of things and look at pictures of different patients that have had this before. So it's key.
And I would imagine that if you shorten that learning curve, that probably a lot of the attrition that happens early on in people's careers, because I walked in and this is way more than I bargained for, you start to help make up for some of that. You know, gosh, it would have been so much easier had I had a mentor in the beginning, or had I had a buddy to walk me through it.
Yeah, imagine coming out of nursing school in the middle of this pandemic, working in an ICU, trying to learn with, that was another thing, they were cross-training. They were bringing in nurses that weren't specialized. Say it was an ICU, they were bringing med-surg nurses in, or PACU pre-op nurses in to help the ICU nurses. And then there's graduate nurses coming into the same unit. Who do you learn from? Who knows what they're doing? Like, you need to know who you need to turn to in these situations. And I couldn't imagine being a graduate nurse during that and being able to make it through.
I think in terms of mentoring and melding technology with that, like we see a lot of 3D printing that's happening in our industry, in the architectural and design industry. Is there a way that we can create a system where something of an image or a body, either a heart or something, where doctors can easily 3D print that that specific organ or what, and then be able to collaboratively work on a solution. I think the easier that we can make it for them, the shorter that learning curve for that next professional would be.
Yeah.
If we're able to create spaces where they can easily pull up medical records and have that ability to mentor young staff easily in a break room setting or in a smaller conference room setting similar to our breakout spaces, then it's easy to mentor somebody and talk to them specifically on a patient, as opposed to having to work in a bedside or in a nurse station where there's a lot going on. Is there an ability for them to bring that information in a smaller one-on-one or 1-to-2 environment where they can teach younger staff and be able to collaborate on a solution, not just from the older professional, but from a younger professional telling them, why can't we do this solution?
Yeah.
I think we'll see more creativity in that as well. Creativity, innovation. We're designers, we're creative, we're innovative, but nurses are the same way too. Healthcare providers, you have to be creative when you're taking care of the patients. You don't have whatever it is that you need, you find something else and you MacGyver it. They're creative people. So I think the more creative aspects we can put into our designs and bring them along for the ride, they'll get creative too. And I mean, I don't know, it's crazy to think of what we could possibly do in the future with that.
Yeah, I love that. So, one of the things that I always find remarkable when I look back at the past, like you said, Nikki, who knows how long it's been, but when I look back at this pandemic is the frontline workers in all of this. And I remember in the beginning, a lot of people would, hang out their window and ring the bells for them. And truly, I think we start to realize exactly what we're asking for nurses and doctors to do on a daily basis. And when we think about their safety, not just from the safety of mental health patients and behavioral health patients and all of that, but maybe even just their general safety, I think a lot of healthcare providers were very worried and concerned about their own well-being and that of their families.
They're putting their lives on the line every
Yeah.
single day, every
Yeah.
time they walk through the door.
So anything that you're seeing in terms of how we finally respond to that, and maybe how we've changed our thinking because of it?
We're seeing a lot of design innovation that's happening on the front end of healthcare facilities, specifically emergency departments. Because if you think about it, the sick patients are going to show up at emergency departments as a first entrance to the facility. I think the ability to isolate potentially sick patients, which probably could be far worse than what could be originally diagnosed, will go a long way. Are you able to segregate potentially sicker patients with the less sick patients? And then how do you handle the staff interacting with them? There was one project, I think this was at Mayo Clinic, that one of our colleagues did. They were able to create isolation rooms, isolation waiting rooms, where potentially sick patients and their families could go into an isolated room just within the same waiting room. But the intent of it is they're separated from the potentially not as sick patients. If you have a respiratory problem, can you be isolated to where the people that are coming with broken bones doesn't have to be mixed? And then potentially as the staff come in, they already know, this is a potentially riskier patient. We need to gown up or put on a PPE to help make sure that our staff is safe. And then can that room be negatively pressured so that staff that are coming in feel that they are more protected based on that built environment, that room is negatively pressured, similar to as you're walking into an isolation room where you feel that the patient's needs are being met from a physical design standpoint, and you're not exposing yourself to more potential sickness.
So it's been interesting to think about kind of these major changes, and it really thinking about the healthcare spaces is not just a place to provide care for patients, but to care for those who are responsible for that, and to think of it as a workplace. What do you think the future holds for the future of healthcare facilities as a workplace even?
I think it's going to be a hybrid. Well, we definitely can't go back to what we were before because it was already kind of a broken system. But I think we'll find a balance in between all these like crazy ideas that people have, and do like a hybrid. There's going to be a lot of collaboration, like Gerard talked about with the new pandemic. There's going to be more coming. It's being prepared is a big thing for the future. How can we help facilities prepare for the next pandemic? How do we make them as safe as we possibly can? So I think safety and flow of people is going to be two major issues.
I think for me, you're going to see more of the movies that we've seen, like these technology that we're seeing in movies come to life, because it gives design professionals and people that are working in technology a place to shoot for in terms of what that built environment would be. I think that's we're going to get closer to that level of innovation and creativity and future technology. I think that's where we're going to head, and I think it's going to be exciting how the new generation will practice their healthcare technology.
Yeah, I think you guys have both touched on the idea of creativity for healthcare providers. It's not something we typically think of, right? Mm-hmm. But whether they're trying to investigate what the accurate diagnosis is for a patient, or, gosh, I don't have this piece of equipment, what do I do about it? Mm-hmm. And I think we can only really get there to that level of creativity or providing that level of care when we really think about when we're well supported ourselves, physically, emotionally, professionally, socially, and all of those things. So this has been a really helpful conversation. Thank you guys so much. I think we're just getting started here, but a really important and timely one to have.
Thank you. It was great being here.
Thank you.
Thank you.
And thank you for joining us. If you have any more questions about the burnout in healthcare or want more information, click on one of the links below, and we'll see you on the next episode of The Square.